Hi, my name is Lauren Dooley, and I am a George Mason University student. I'm doing this presentation on training educators with Fidelity. So to get started, I wanted to quickly go over the literature. First, I was pleasantly surprised to find an article that was a study, and the title of that article is Pre-Service Teacher Delivered Behavioral Skills Training, a pyramidal training approach. So, what I want to point out in this first article is that this is the first time that I've heard of behavioral skills training, or BST. This is a type of training that gives you steps in an order of how to effectively use data and using modeling, sometimes videos, and a lot of opportunities for the person who's being trained to respond and initiate each step in the training as they're learning how to do it. And something that was particularly fantastic about this first literature is that it essentially opened a doorway for me to understand that as someone who is studying applied behavior analysis, that it is not just my job in the educational field to support teachers and students. My main job should be making sure that the teachers can support their own classrooms. And then, going in and doing supplemental maintenance work. But I should be able to teach a teacher, an educator, to be competent, confident, and really use each intervention as an opportunity to have high fidelity. And a lot of the reason why this isn't happening in schools currently is because teachers really aren't trained to train. And I think that it's important that we do use applied behavior analysis principles to do such a thing. And it's such a simple concept that I had entirely missed during my studies. But it seems to be that it could be an answer to many of the problems that I have personally experienced as a public school educator. The second article that I found is titled The Use of Behavioral Skills Training to Improve Staff Performance of Discrete Trial Training. And now I found this particular article and study to be entirely relevant to the main topic of how do we train educators using applied behavior analysis. And as I had mentioned, how in awe I was of the simplicity of an applied behavior analysis approach to create significant impacts in the quality of services that and training that teachers are providing. However, in the first study, they were missing the component of directly training paraeducators, which, as we all know, the use of paraeducators has greatly increased in terms of providing direct academic and behavior support in order for the teacher to oversee the entire classroom, as many students who have an IEP do require significant interventions and accommodations and modifications. And in order for the teacher to make all of that happen and to complete all of the IEP services and hours, they require significant support from paraprofessionals, from their paraeducators that are assigned to their students in their classroom. Now, what this second article does is it shows and it proves that it is possible to use the BST training program the behavioral skills training list, which I will go over soon, to train paraeducators. So if you look at this, the first article is saying, yes, we can train teachers to be trainers. And the second article is saying, yes, once these teachers are trained with Fidelity, they are able to successfully train paraeducators to implement evidence-based practices and behavioral interventions with extreme levels of fidelity, which is a significant increase in the data that is currently being collected from the paraeducators and the teachers, insisting that fidelity has not been to a high standard, which we all know is the only way for these interventions and evidence-based practices to actually work to the fullest extent of the goal behavior or the goal knowledge to be learned. Now, the third article I chose because another thing that I have noticed special education teachers experiencing, and I have also experienced myself, is that general education teachers, specials teachers, academic support professionals, everyone else who is not specifically trained in special education, and everyone else who does not specifically only work with students with special education, I've noticed that they want to help. The problem is that there isn't really significant training for them to be able to support some of these behavioral interventions that could require the duration of the entire school day. So every setting that student is present in, not everyone understands what the intervention is or understands how to implement the intervention with fidelity. And a lot of that is due to lack of background knowledge. But also, there could be external circumstances that could be preventing them from, for example, being able to execute an intervention with fidelity. For example, why this article is so influential in the point that the wisdom that I've come to through these three articles, if you put them together, is that incorporating applied behavior analysis to assess and support educators' treatment integrity is just as important as training teachers how to train, and equally as important as training paraeducators to work directly with our students with extreme integrity and fidelity. And then if we can also do something similar for support staff and support educators or general educators, we would be able to increase our goals that we're searching for when we go to implement a behavior intervention or an academic evidence-based practice. And we have these really good ideas, but the framework is not currently in place to assess each step of the intervention. And not just assess to, for example, not just assess to, tell teachers what they are and aren't doing, assess in the vision of applied behavior analysis perspective. And how we do that is to assess, just like this. And for this last article, they used the antecedent, behavior, and consequence method. The teacher who had worked to come up with the intervention or the support, um, is able to observe the general education teachers and the other support staff while taking ABC data, while these staff are implementing the intervention, and we can separate out if there's an antecedent that is causing the teacher to not be able to do the intervention with fidelity and integrity. Okay, so the first thing that I want to talk about is how do we effectively train educators? And this is before, we should be doing this before they enter the field, before they step into a classroom. If educators who are finishing up their coursework and their student teaching are trained to train by an expert trainer who already has the behavioral skills training down pat. If these educators are trained using behavior skills training to train paraeducators in how to use behavioral skills training, um, as well as other evidence-based practices, of course. And I wanted to go ahead and go through each step and what that might look like. So, in order to complete BST, there are 15 steps. The first step is to provide a rationale for the target skill being trained. So that makes a lot of sense, especially paraeducators who, didn't go to a teacher certification program. Um, and by telling them why we want to get to the goal and what sort of impact that would have on that student's life and how it is socially relevant, which all of our goals should be. Everything in ABA should be socially relevant and should focus on the student and what would best help support the student to be able to be a productive member of society in a happy and healthy way. And number two, vocally describe steps of the target skill. So, you're not going to go from not being able to hold a broom to being able to sweep the floor of an area in a room, and get it in the scooper and then get it in the trash. Sometimes you need to break down the steps of the target skill to show how the student does not have the prerequisite skills to jump right into sweeping a floor. There are other steps that need to be taken in order for them to do that. Number three, provide trainee with written summary of target skill steps. So, for example, if I'm the expert trainer, I will provide a list of these 15 steps in writing so that they can see it. So far we have auditory, so I'm providing the rationale and vocalizing the steps to get to the target skill. And number three, I am providing the trainee with a visual, with a written summary of the target skill steps. And those three things allow the educator to process and make it become somewhat personal so that they can, really want to help the student based on the first three steps that I have gone over with them. Now, number four is now that the educator is invested, for number four, we demonstrate or model the target skill. So if I'm teaching BST to a teacher, I'm demonstrating and modeling the target skill in using BST to train them about BST, how to be able to train using BST. Number five, ask if there are any questions, and this is so important. And yes, it is important just to ask if there are any questions, but a lot of times, especially in the education field, sometimes people are a little too shy or nervous to ask questions. And so that is on the master trainer or the educator to create a relationship with the person that they are training to the point where that person feels comfortable asking any questions they may have. And this is done in large part by the trainer or the trained educator, trained on how to train, is able to show either the educator or the paraeducator that they not only want them to be able to do this skill, but that they are extremely invested in supporting the educator or paraeducator in learning how to do this skill. So number 6 is answer all questions asked. If you don't know the answer, tell them you don't know the answer and promptly find the answer and provide it to them. Number 7, provide trainee with all needed materials. So this works at the top of the pyramid in that when the master trainer trains the educator using BST on how to use BST for the paraeducators, you can provide materials for them to practice. Now, when we're looking at training the paraeducators, that step might look a little different. Number 8, have trainee practice performing the target skill. This is huge. I know that for myself, I do my darndest, but lectures and reading is helpful, but only to a certain extent. So I have a personal connection to step 8 because I feel like that was the stepping stone for me to be an expert at what I do. And number 9, monitor the trainee during practice. Don't just say, okay, go off and do it. You definitely want to be monitoring what they're doing, providing feedback, and just making sure that you get a sense, especially on this number 9 step, that you get a sense of the comfort level the educator or paraeducator are at, and maybe get a better focused understanding of their skills and weaknesses and how you can use their skills to help their weaknesses. Number 10, observe and record trainee correct versus incorrect performance of target skill. So basically, this is just a task analysis assessment of the employee. And at this point, I know that I myself, after going through the coursework for applied behavior analysis, that I feel pretty confident that I am able to run a task analysis, not only on students, but for other educators as well. Number 11, provide supportive and corrective feedback. Now, I've gotten a lot of corrective feedback in my career. I have not gotten a lot of supportive feedback. So, and this is important, and we all know this is important in ABA, to provide that positive, supportive feedback just as much, if not more, than you are applying corrective feedback. And why we do this is because it's positive reinforcement. You want to show that you're supportive and that you're not there to test them. You're not there to tell them they can't do it. You're there to provide support for them. You're there to teach them how to do this. You're teaching. So, and as we all know in ABA, positive reinforcement is the most effective way to increase someone's skill level. And corrective feedback is important as well, especially when an error is made. But you do want to make sure that you're providing more positive reinforcement for the behaviors that they are doing correctly than corrective feedback for the parts of the task analysis, the steps in the task analysis that they're having difficulty with. You want to provide some level of prompting. Number 12, ask trainee which steps they perceive they did correct or incorrect. So I love this one as well. I was fortunate enough to work for an applied behavior analysis company that trained me in this way. So while the observer was taking a task analysis on me, I was also taking a task analysis on myself post activity, though. So we are relying a little bit on memory, which sometimes isn't as accurate as an in the moment direct data collection. But that's fantastic. That is fantastic to understand how both the observer and the person being trained are perceiving what is mastered skill versus a skill they need to work on. And that could be a matter of perspective of what each person considers mastered. And number 13, ask if there are any questions. Again, goes back to number 5. You can want to keep checking in because, in this sense, it's formative assessment. So you want to know what kind of questions they still have. And in that way, and number 14, answer all questions asked. And this is very important because if the person being trained is unclear about something, that could change their perspective. For example, if they're unclear about what mastery really means in the task analysis, then you'll be able to catch that and you'll be able to help support them in adjusting their perspective. Or you could be the person to make it more clear for them and you can learn for yourself how much the words you use matter. And number 15 is repeat steps 7 through 13 until the trainee can perform the skill. So this is really where we get into very intensive direct instruction. So steps 7 through 13, you keep repeating until the level of mastery has hit the goal that you are looking for. So once educators are trained before entering the classroom, they're prepared and expecting to train the paraeducators that are present in their classroom, assigned to their students, or assigned to their caseload. Now, in order to train paraeducators, teachers are ready. The teachers can use the BST 15 steps. So it's the same steps that they had learned how to do, and now they know how to do it themselves. And so they can use the BST 15 steps to train paraeducators in all different kinds of evidence-based practices. So for the purposes of this presentation, let's say that the teacher is going to use BST to train their paraeducators to be able to successfully implement a discrete trial training session. In this specific article that I found, specifically on this topic, there was a baseline done, and a lot of the paraeducators who have been paraeducators for a long time were able to implement DTT with 64% fidelity. That's not bad, but if you do the calculations, that is a lot of wasted time that is not truly effective for the student. And if these paraeducators could increase their fidelity to over 90% with only maybe 3 20-minute sessions, their fidelity could potentially increase to over 95%. Now, what is shown in all of these studies, when you compare all of the results to all of the studies, that paraeducators do require the most maintenance. And so with the 3 initial 20-minute training sessions with the paraeducator, they will increase their fidelity, and over time, it will slowly decrease. And one way that we can mitigate this or be as supportive as possible for our staff is that we can also use ABC data to make the support more individualized. And in using the ABC data, we can not only help maintain the integrity of the paraeducator's ability to implement these interventions, which they are the people most likely providing these intensive interventions to students who are highly impacted by their disability in the public education setting. We can also use this ABC approach in assessing educators' intervention fidelity. So not only can we use the ABC approach to work on individualized maintenance plans for our paraeducators, we can also assist general education teachers, specialists, administrators. We can do all that by taking antecedent behavior consequence data. And we all know how to use that if we've gone through ABA 101. And it is really not that difficult of a data set to take. And once you get that documentation, you can use your ABA principles and skills to figure out what it is that could be preventing this professional to be able to provide the intervention with fidelity for the student. And a lot of times it is a simple fix. For example, the screaming in their class might be irritating to that person. Instead of saying, stop sending Billy to the office, we can figure out why Billy is being sent to the office instead of the planned ignoring during his screaming behaviors. Now, it is much harder to just say, don't do this. And we usually don't do that as ABA providers. What we do is we figure out what the core issue is, and we support our clients in being able to be successful. And so we should be doing the same for educators, for support staff, for administration in the public school setting. And if we can model it for them, they can model it for the students, and that would have a much greater impact on all children across the United States who are in the public education system. So we took the ABC data, we figured out what the antecedent cause could be, or we figured out how the consequence is maintaining the behavior that is not desired. So we identify and clearly define the goal behavior. Now, we all know how hard it is just to be told not to do something and immediately do the goal behavior. So the way the third article was written is that you can be supportive. You can find an alternative behavior that will help them still get the same consequence they were receiving without them inadvertently maintaining the student's behavior. So you can find a middle ground where the student's intervention won't be significantly impacted in the wrong way, but also the teacher is still, or the professional, the educator, is still able to gain access to the consequence that was easing whatever the antecedent had set off. And once you do that, once you find the alternative behavior, kind of get everything back to a middle ground. It's not going to be perfect. It's not going to be quite like the behavioral intervention or the academic intervention that was planned, but it's a better start. It's a better starting place to be able to effectively support the other employee. And then where you go from there is you do a task analysis. So, okay, teacher A, who's a general education teacher, third grade teacher, is unable to do 50% of the intervention we'll start the goal at them completing 50% of the intervention consistently, and that will be their mastery. And then once they hit that, you can slowly increase the amount of steps that they are responsible for that are laid out in the intervention. And you basically slowly unfold the intervention, not for the student, although it could end up being helpful for the student as well. You slowly fade in the intervention so that the teacher can get comfortable with each step, so that it becomes habit or second nature or a learned behavior. All of these articles have been significantly impactful in terms of my professional perception of how we can best support our students. Now, I have always been a huge advocate for introducing applied behavior analysis principles into our public education system. Now, this is more often being somewhat accepted as an intervention for students, but I have noticed that applied behavior analysis is not being used for adults, for employees, for structural decisions, or assessment of employees. When I'm being observed, I don't know what they're looking for, what they're looking at, and then there's no follow-up on, like supporting me. It's more of just like, again, informational sheet of paper telling me what my skills and weaknesses are, and then that's it. And a lot of times when the skills and weaknesses are written out, I'm not really, it's not written out to quite to the level of detail and word choice that you'll find most BCBAs using. And I think that that alone could create significant improvement in student outcomes. And that's why this is socially relevant to me. I've been watching fellow teachers, special education teachers, just really their stress levels and anxiety are extremely high. There's a high turnover rate. A lot of my coworkers leave on a yearly basis. The para-educators, the culture within public school, at least all the public schools I've been at, the para-educators are not seen as educators. They are genuinely seen as less than. And, sometimes they're just being moved around the school, like support para-educators who maybe are not skilled enough to be doing their job are just moved around. They're not assessed and supported and trained in a meaningful way. They're just moved to a different part of the school where they don't need as many skills. So, for example, a one-to-one paraeducator who is assigned to a student with autism who is participating in the general education setting is unable to perform their duties. That is not their fault. That is not their fault. They need additional training in the ways that I just described, in an assessment and support mentality, using data. And we can keep those people in those, more difficult assignments. And, when someone feels like they're not skilled enough and that it's their fault that they're not skilled enough and they're moved to do recess duty, what kind of impact does that have on employee motivation? What kind of impact does that have on employee confidence and self-esteem? And these are the people who are spending the most time with the students, the most direct time with the student. So I think that this pyramidal approach and this general perspective of assessment and support using data, but also, just having the perspective of I'm supporting them. I'm not reprimanding them. I'm not getting frustrated at them for not being able to do what I know how to do. Effective leadership is based off of someone who keeps the high jump bar at a good level where people might be able to jump over, they can get close to jumping over the high bar. And what the leader should be doing is holding the hand of the people that are jumping over the high bar. That is it. We are holding the hand up until they get up to the high bar, and we help them get over that final couple of inches. A leader is not someone who sets the high bar super high, jumps over it themselves because they're an expert, and then gets frustrated when their employees can't do the same thing. I want to stay on the same side of the high bar as my employees, as my trainees, as my coworkers, as my administrators, as my supervisors. And I want to help all of them together as a team jump over the high bar. That is pretty high, but not too high. I don't want to be on the other side of the high bar looking at them getting frustrated as to why no one else can do it. I know why no one else can do it, and I know that I can help them be able to do it. Using the information, the studies, the perspectives that I've received in this presentation and in this research study. And it's really important to me because the evidence-based practices are fantastic. Most interventions are fantastic. I want them to be able to work. Thanks for listening to my presentation. Again, I'm Lauren Dooley, and I'm a student at George Mason University.